5 signs of colon cancer you should never ignore. Have you been experiencing frequent cramps or pain in your stomach? Are your irregular bowel movements troubling you lately? These symptoms may seem normal, but never neglect them. They can be an indication of something as serious as colon cancer. Colon cancer is the 3rd most common cancer in the United States that can occur in both men and women. The risk of developing colon cancer increases with age, but these days the incidence in younger adults are rising. Early detection of colon cancer is necessary for timely treatment. Ignoring major symptoms related to this cancer can only allow it to progress, making it more challenging to treat. So, in this video, we will share the 5 major signs of colon cancer that you should never ignore. Let's get started with sign number 1. But before that, make sure you hit that subscribe button. The first sign of colon cancer that you should never ignore is unexplained weight loss. Unexplained weight loss is a common symptom that can be associated with various medical conditions. It can also be a sign of a very serious underlying condition, such as colon cancer. Colon cancer is usually caused by the abnormal growth of cells in the lining of the colon or rectum, which can form a tumour. In its early stages, you may see no symptoms at all, but as it progresses, it can cause various symptoms, including unexplained weight loss. Now, what is unexplained weight loss? Unexplained weight loss is defined as a loss of 10 pounds or more without any apparent cause. In the initial stages of colon cancer, unexplained weight loss may be the only symptom present. Colon cancer can cause various changes in the body's metabolism, leading to weight loss. Additionally, colon cancer can cause diarrhea or constipation, which can also lead to weight loss. So, if you're experiencing unexplained weight loss, it is essential to consult your doctor. They will perform physical exams and tests, such as a colonoscopy or CT scan, to determine the cause of your weight loss. Number 2. Blood in the stool. Blood in the stool is one of the major symptoms that can indicate colon cancer. The colon is the first and longest part of the large intestine, and colon cancer typically begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. Rectal bleeding, or in simple words, blood in stool, is a common symptom of colon cancer, and it can manifest in different ways. Individuals might see bright red, fresh blood on toilet paper after a bowel movement, or as red or pink water in the toilet bowl. Blood from higher up in the bowel doesn't look bright red. Rather, it goes dark red or black and can make the stool look like tar, which can also be a sign of colon cancer. Remember, blood in stool can be an indication of several other conditions other than colon cancer, such as hemorrhoids, infections, or inflammatory bowel disease. However, if it is accompanied by other symptoms, such as a change in bowel habits, ongoing discomfort in the belly, a feeling that the bowel doesn't empty during a bowel movement, weakness or tiredness, or unexplained weight loss, it may be a sign of colon cancer. Doctors recommend regular screening tests for people with an average risk of colon cancer, starting at the age of 45 in the United States. People with an increased risk, such as those with a family history of colon cancer, should consider starting screening sooner. Number 3. Changes in bowel habits. Another major sign of colon cancer is changes in your bowel habits. Your bowel movement habits are shaped by your daily activities, your health, and most importantly, your diet. Any significant changes in these habits, such as changes in consistency or frequency, can be an indication of a serious underlying medical issue, such as colon cancer. In colon cancer, changes in bowel habits include a new onset of diarrhea or constipation, thin or narrower stool than normal, changes in size, caliber and frequency of bowel movements, and a bowel that doesn't seem to entirely empty. In the latter case, an individual may feel the need to have a bowel movement even after passing stool. These persistent changes in bowel habits associated with other symptoms like rectal bleeding, unexplained weight loss, and abdominal pain should not be ignored. Remember, early detection of colon cancer significantly improves treatment outcomes. Number 4. Abdominal or pelvic pain. Your abdomen and pelvis consist of a complex network of organs, all working together to keep you healthy. While occasional pain or aches are normal and often harmless, persistent or severe pelvic or abdominal pain can be a major red flag, especially when it comes to colon cancer. Colon cancer, one of the leading causes of death in the US, can grow large enough to partially or even completely block the passage of stool. This obstruction can cause cramping and sharp pains in the lower abdomen as the colon struggles to push waste through. Tumours can irritate the lining of the colon, leading to inflammation and discomfort. This inflammation is often manifested as a dull ache or burning sensation that can be persistent and worsen with certain foods or activities. As colon cancer progresses, it can invade nearby tissues or organs, causing further inflammation and pain. This can result in stabbing pain, depending on the location and extent of the invasion. Furthermore, large tumours can press on nerves in the abdomen and pelvis, leading to throbbing pain in these areas. This type of pain can be confusing, as it might not seem directly related to the colon. However, abdominal or pelvic pain, especially when persistent, unexplained, and accompanied by other symptoms of colon cancer, should be taken seriously. Number 5. Fatigue. Something as normal as fatigue and tiredness can be significant indicators of serious conditions like colon cancer. Fatigue is often linked to colon cancer due to its various factors. This type of tiredness can be debilitating and persistent, affecting individuals before and after treatment. This fatigue is not necessarily predictable and can persist regardless of activity level or rest, sometimes feeling paralyzing. Causes of fatigue in colon cancer patients can include anemia from internal bleeding, nutrient depletion by tumours, stress, pain, and anxiety related to the cancer itself, as well as the taxing effects of treatments like radiation and chemotherapy. Feeling constantly tired without a clear reason should never be ignored, as it could be a sign of an underlying medical issue, potentially something as severe as colon cancer. So, if your state of fatigue and tiredness does not get better through rest or proper sleep patterns, immediately seek medical attention. Your bodies are constantly communicating with you. All you have to do is pay attention to the changes in how you feel, particularly persistent or concerning changes. Early detection is key, and a simple conversation with a medical expert could be the first step towards a positive outcome. Like all cancers, the treatment of colon cancer is most successful when caught at an early stage. Although regular screenings are necessary, recognizing the major signs and symptoms of colon cancer can be a lifesaver. It's time to be proactive about your health. Do you know of any other major red flags that can be related to colon cancer? Pour in your thoughts and suggestions. We'd love to hear from you. If you like this video and want more insightful content like this, make sure to like and subscribe to our channel. Till then, have a great day.